Thank you so much, sir. With this, we have come to the last talk, Communication with PCR Patient, Consequences and Prognosis by Dr. Prateek Gujar. Dr. Prateek is a cornea fellow from Shankar Nethralaya. He is working at Bhopal and he has written various books and various chapters in the clinical textbook and has many publications, and currently working as a director of Sudarshan Nethralaya, Bhopal. Dr. Prateek, please. And I request, because you are the last speaker, so you have to cut down your talk. We are running short of time.
Yeah, thank you, Dr. Vinita and Dr. Chawla, for making me part of this presentation. I'll be speaking on communication with the PCR patient, consequences and prognosis. So as a surgeon, we are trained to do beautiful surgeries, but an important part which is often missed is the communication part. The ability to give bad news, counsel, comfort, discuss treatment options and alternative is very important, because good communication prevents doctor shopping and non-compliance to the treatment, thereby improving the prognosis in situations like PCR. Now, what happens routinely in our OPD when we are talking and discussing treatment with the patients, what the attendant is usually doing is this. The moment they enter our OPD, they take out their phone and start checking their WhatsApp messages. So this has to be strongly discouraged when we are, communicating with the patients. Also, we have seen that attendant who are coming prior to the surgery are often different to the attendant who are coming after the surgery, and especially after a surgical complication. So this picture might be an exaggeration of things, how things can worsen, but yes, definitely communication part is very important with this subset of patient, and so you have to increase the chair time with this subset of patient. The communication start right from the pre-operative period, where you have to identify high risk patient as listed by my previous speakers. You have to make note of these high risk patients and take written informed consent from the patient and attendant in their own language. That's very important part. Intraoperatively, as already discussed, you have to stay calm, don't panic, because PCR is not only a surgical event, it's a psychological event for the surgeon, and the whole atmosphere of the OT changes once we have identified PCR. Try not to show any signs of frustration, take a deep breath, and do not speak anything which the patient might hear and they can think anything about. So do not raise your voice level, that's very important. Whatever you have to communicate with the OT assistant or OT staff, you have to do very calmly. And if anything needs to be conveyed to the patient, again, like you are changing from topical to perivalvular anesthesia, communicate it very slowly to the patient. Surgical intervention, as already discussed by my previous speakers, but not to forget about the making surgical notes and intraoperative documentation of whatever treatment plan you have changed. That has to be documented very seriously. Post-operatively, you might want to segregate these patients, because these patients require more chair time and more assurance. So try to call them in non-peak hours, OPD hours, so that you can give them more chair time. Also, it's important, you want them not to mingle with your routine post-operative patients, because these patients might not be having the wow factor. And complications you have to discuss with these patients. These are the list of complication, both anterior and posterior segment complication. I will quickly run through these slides. And post-operatively, you might need to discuss, apart from complication, any change in the treatment plan which you have done on the first post-operative visit, any further management they will require, and the visual prognosis. Try to make all these communication presence of an attendant, and try to duly record all these and document all these communication with the patient and attendant. Taking a second opinion with a VR person or a cornea or glaucoma person or a second surgeon always helps to build a trust with the patient in these case scenarios. Post-operative management, apart from good patient communication and managing expectations, you might want to hike up steroids, NSAIDs or IOP lowering agents. Closer follow-ups are required for these patients that you have to convey. So to conclude, these patients, right from the pre-operative communication to post-operative communication, you have to try to give more chair time, more assurance and empathy to this patient. Try to take a second opinion, and importantly, you have to keep upgrading your skills, so that you might want to learn vitrectomy and secondary eye implantation, so the visual prognosis in these patients can be improved. I thank you for your patient listening.
Thank you, Dr. Prateek. Your concluding slide was excellent. With this, we want to close this program, and I would like to thank all the panelists Dr. Gajin Chawla as a co-chairperson, and all chairperson and all the speakers. Thank you so much.
Thank you.